by our city manager, Dee Williams Ridley. And thank you for what will likely be our last COVID-19 town hall. And look forward to providing you updates on the city of Berkeley's efforts to combat COVID-19 and the plans for the future. And I just want to start by acknowledging that we started these town hall meetings early on in the pandemic, actually in April of last year. The COVID cases were just starting to spread in Alameda County and the city of Berkeley. Our residents were deeply concerned about this public health emergency and wanted to know more about the city's efforts to address COVID-19. And so we felt it was a good opportunity to hear directly from the leaders, the people that are working day and night to respond to this public health emergency and to protect our community, to hear from them firsthand and to be able to ask your questions around what the city of Berkeley is doing and what we all can do collectively to address COVID-19. And I'm very pleased to say that we've had actually 29 town hall meetings over the last 15 months, including some specific town hall meetings with the Brooklyn Unified School District and with State Senator Nancy Skinner. And over the past 15 months, residents have submitted over 1,000 questions to myself and to our panel. And we have done our best to answer all the questions with as much detail as possible so that you can get a deeper understanding about what we're doing and what we all can do to address COVID-19. I think these town hall meetings, which frankly have been unique for the Bay Area. It's not often you have the public health officer of the city and the city administrator and the mayor collectively presenting to the community on a weekly or biweekly or monthly basis about our work in this area. But I really do think that it's increased transparency. It has helped better inform our community and provide a direct link to our city decision makers as we have gone through this difficult year. I just want to reflect on the past year, the past 15 months. When we first heard of the first cases of COVID-19 in Alameda County and then ultimately in the city of Berkeley, little did we know all the challenges that we would face as a community. But I am very proud, thanks principally to the leadership of these two amazing women here on this call and the people of Berkeley for your commitment to science and to protecting the health of everyone in our community, that we can look back and say that we have crushed the curve and that we are working really hard to get everyone in our community vaccinated and that it has saved thousands of people's lives in our community. And our community will be even stronger and more resilient going forward to respond to pandemics or any other emergencies or challenges that we may face. But through it all, we know there's been a lot of pain, a lot of suffering, needless deaths. Our businesses were closed. People lost their jobs. People are facing extreme housing insecurity. But through it all, we have really centered our response with our community's values and with the goal of looking out for everyone and lifting everyone up and helping everyone. And I'm just really proud of how far we've come and recognizing that while this may be one of the last town hall meetings we have on COVID-19, the work isn't over. We still face a real threat out there in our community, an invisible threat, but a real threat. And while, reaching close to 70% fully vaccination in the city of Berkeley certainly helps in terms of helping reduce the spread and transmission of COVID-19, we know that there's more work to do. So let us hope that this is the last town hall meeting. But let us also remember that our work is not done and that we must continue to be vigilant, to follow science, and to protect our health and the health of our neighbors and our friends in the Berkeley community. So with those opening remarks and in recognition of the great sacrifice and work that our amazing leaders here have done, overcoming incredible odds, and all the vigilance and work of our community to get us to this point, I want to now turn the floor over to our public health officer, Dr. Lisa Hernandez, and just take this opportunity to thank her so very much for all that she has done We're just so fortunate to have had an incredible leader guiding us through this difficult last year, and just deeply appreciative of her tireless work, and know that it has really made a difference. So, Dr. Hernandez, I want to turn to you, and if you can update us about the current number of cases in Berkeley, and any latest news on shelter-in-place orders. And I know that there have been questions around the Delta variant and its spread in Alameda County, and precautionary steps we can take to help address the impact of that variant, and any other information you'd like to share with the Berkeley community tonight.
Yes, good evening. And I can't believe it's been nearly 30 town halls that we've done together. And it's just shocking and mind-blowing. And I am honored to have the opportunity to share this information with the community, and to share this platform with you, Mr. Mayor, and with Madam City Manager. So thank you very much. I'm honored and humbled, and I appreciate the support from you as well as the community. I won't say more because I'm trying not to be emotional, because I've got a report to give, and I'm going to give you that report, and then maybe in closing remarks we can share more. So I'll start with the numbers as usual for Alameda County, and this does not include the case count, does not include City of Berkeley case counts. County has 86,494 confirmed cases of COVID-19. Hospitalizations today, as of today, people currently hospitalized are 45 individuals, and that does include City of Berkeley residents, though we actually normally does include City of Berkeley residents, though we do not have a City of Berkeley resident who is hospitalized at this time. And ICU is 17 individuals in the ICU at this time. Again, not including City of Berkeley residents, because we do not have any residents either in the hospital or in an intensive care unit, which is really great news to hear. Total deaths for Alameda County, again, excluding City of Berkeley, are 1,228 deaths. And we still, both the county and the city, still report the case rate and test positivity, even though those the tiered system which use those indicators have been retired. These are still key measures that we monitor to look at the spread of COVID-19. So the case rate for the county is 2 cases per 100,000 per day. And their test positivity is below 1% at 0.9% of the tests that were collected that were positive. So both good numbers. I will say that when we're looking at the county case rate and their hospitalizations, we're seeing a little bit of an increase in the hospitalizations and the case rate. We're seeing a little bit of an increase in our case rate as well. But we're hoping that this has to do with the fact that we just reopened 2 weeks ago. And we're going to see cases with increased movement. And just as you've seen in the news, a lot of those cases are in individuals who are not vaccinated. So I'll talk a little bit more about that later, but just wanted to point that out right while we were looking at the numbers. In terms of vaccination status for the county, 68% of individuals that are 12 years and older are fully vaccinated, and 81% of individuals 12 years and older have received at least 1 dose. Now, those are great numbers for the county, and we see similar data, and I'll show you that. I'll mention that in a second. In terms of case count for City of Berkeley, we now have a total of 3,671 individuals who have been diagnosed with COVID-19, and we're seeing about 1 case per day. We were at one point not seeing any cases per day, so that is a little bit of a blip. Sometimes we'll see 3 cases in a day, but again, as I mentioned earlier, we're watching that, and we do see that some of this is associated with just reopening. We did see 1 Delta variant which is one of the variants of concern diagnosed here in the city of Berkeley. But that was a couple of weeks ago that individual contracted the COVID, and at this point does not have any threat to the community. In terms of hospitalizations, total 129 individuals have been hospitalized in the city of Berkeley. Again, none currently hospitalized, and a total of 50 individuals have succumbed to COVID-19. And our case rate is 0.6 cases per 100,000 per day. And our test positivity is also below 1% at 0.15%. So very good numbers in terms of our case rates and our test positivity. And our vaccination numbers, we are seeing 67% of Berkeley residents 12 years and older being fully vaccinated, and 79% of Berkeley residents 12 years and older having at least one dose. So very similar to the county numbers in terms of vaccination rates. And what we're doing here in the city of Berkeley for our vaccination efforts, we continue to provide vaccination in two larger settings, actually three settings. Two are broader. One is the vaccination site that we used to have at Golden Gate Fields at Buchanan Street, has now moved to the Berkeley Adult School, and it's a consolidated site for both testing and vaccination. And also we are continuing to have some of our community clinics. This week, we're finishing up the second doses for the middle school clinics that we did 3 weeks ago. And we're also doing a clinic in Casa Zimbabwe, which is one of the co-ops for the that house most often UC Berkeley students. Those are second dose clinics. However, if you haven't gotten your vaccine and you want to walk up to get your first dose, you're more than welcome to come. We will accommodate you and make sure you get vaccinated. We also we're still finishing up our at-home vaccination clinics, where we are going and vaccinating individuals that are homebound, and we're finishing up those vaccination clinics. And again, if individuals are homebound and have not received a vaccine and want to get vaccinated, we will serve individuals who do call and need that vaccine. We are also working to get more community providers offering vaccine. We're working with the county to get some of our pediatricians online with offering vaccination. And of course, Kaiser and Sutter and John Muir are offering vaccines. So the vaccine is out there. And we are hoping that those individuals who haven't gotten vaccinated do take advantage of those opportunities. We are planning for the next school year with back to school events, both with the Berkeley Unified School District College when Cal comes back into session, and also hoping and waiting for the expanded age eligibility when the vaccine is approved for younger individuals younger than 12. And as we know, a lot has happened since we were here reporting. We are now beyond the blueprint as of June 15th, so that's about 14 days ago. And most of the formal restrictions have been removed. And as I mentioned earlier, the tier system has been retired. The most notable restrictions that have ended are physical distancing and capacity limits at businesses. The city of Berkeley has aligned with the state. Alameda County has also aligned with the state. The health officer order for the city has reflected that, was updated, and reflects that guidance in terms of not having any additional restrictions than the state. We also know that there are a couple restrictions that have remained that the health officer for the state has required vaccination in certain settings. And those settings, and does not matter whether you're vaccinated or not, those settings include public transit, hospitals, long-term care facilities, shelters, homeless shelters, cooling center shelters if we have them, and any inclement weather shelters or fire shelters if and when we need shelters due to fires throughout the state. Those shelters will require masking, whether you're vaccinated or not. And then indoors for K to 12 schools, childcare, and other congregate use settings, and that's indoors. For masking in general, if you're vaccinated, except for those specific settings or due to restrictions imposed by a business, vaccinated individuals do not need to wear a mask inside or outside. For those that are not vaccinated, there are restrictions for indoors, and also for restrictions for when you are in certain settings. And that includes outdoors when you cannot maintain physical distancing. That is when you're going to be required to wear a mask. The governor and the state health officer has also required that in certain settings that vaccine verification or a negative test is required. And that is for indoor mega events. And those are events with 5,000 or more individuals inside. That's where you will have to either show verification of your vaccine status or a negative test. It is recommended that this also verification or vaccination verification also occur out in outdoor mega events of 10,000 or more. Also, what has happened is Cal OSHA has adopted the guidance of the state in terms of their emergency temporary standards, and they've aligned again with the state and CDC in terms of not requiring masking for individuals who are vaccinated indoors for employees, but employers can be more restrictive if they'd like. That there's a full page on the Cal OSHA website that gives information about the guidance there in terms of what settings and what employers are required to do. I will stop there and hand it to you, Mr. Mayor. I will talk about the variant. I know there's a question about the variant in the question and answer session, so I'll talk more about the variants at that point.
Thank you so much, Dr. Hernandez. I now want to turn the floor over to our city manager, Dee Williams-Ridley, and also want to take this opportunity to thank the city manager for her incredible leadership of our city government this past year. And Madam City Manager, if you can provide us an update on city operations. I know that City Hall is reopened, so members of the public can come for appointments and other business. I'll turn over to you.
Thank you so much, Mr. Mayor. And yes, the last 15 months have been probably the most incredible, just tough year and a half of work for our city, but it has been absolutely worth it, and definitely my honor to serve our community alongside Dr. Hernandez and our council and our entire city staff. So I want to thank you for the many, many town halls in which we were able to provide direct information to the Berkeley community, which I think was an incredible, foresight from you in making sure that our Berkeley community was communicated with in multiple ways. So I just want to thank you for that. And then just to share a little bit about where we are in the city. So as you are well aware, and many of our residents may be aware, on June 15th, all of our city offices were open from the hours of 10 a.m. to 2 p.m. And we have an expected full reopening by July 19th. It's the first, I think it's the second Monday in July. So July 19th, we're envisioning a full reopening of all city facilities between the hours of 8 a.m. to 5 p.m. We were using this time frame to grasp the gravity of our community need, reestablishing some of the work processes and procedures. With us still being in a pandemic, we wanted to make sure we opened safely for the community. We are at this time still requiring that our community wear masks as they visit indoors at city facilities. And we want to make sure that they observe those restrictions still. As we progress in our reopening, we are open to receive input from our community on ways in which we can make sure that they feel safe as well. So it's just not about our city employees, it's also about our community and everyone feeling safe as they secure city services. Currently, stepping into a whole new conversation, currently we have a lot of processes underway in the city operationally. As many folks are aware, tomorrow is our budget, our final budget hearing where the city council will hear the mayor's recommended proposed budget and adopt a budget because we are required by law to have a balanced budget. So come July 1, we will have a balanced budget as the city has always done so. Also, all of our city labor contracts are open and we are moving very swiftly with labor negotiations. We have worked really hard with our bargaining units and we continue to do so. The city council and my office and our entire department leadership, we value all of our Berkeley employees and we're working really hard to land on tentative agreements with some of our bargaining groups. And we'll continue to work with all of them as we address some of their needs and making sure that their wages and conditions of employment are fair. Also at this time, we're still in an EOC activation within our city facilities and city hall. That means that a number of our staff are still deployed and working on various issues related to the pandemic. We're slowly going to be retracting and moving those folks back into their normal work routine, but we are not there yet. So we still have staff that are totally engaged in the health side of the pandemic, as well as the communication side and our public safety side of the pandemic. And so there's just a number of people still very much tied to that work. There are some questions on the budget, and I think we'll get to those later, but I want to thank the Berkeley community for their resilience, for their trust in us as leaders here in the city, and we appreciate them and their work in helping to curb the pandemic. Thank you.
Thank you, Madam City Manager. One thing I also want to add, and it's a question we've gotten, is what is the plan for resuming in-person meetings of the City Council and boards and commissions? And the governor several weeks ago signed a new executive order, amongst which will suspend the provisions of Executive Order N2920, which suspended part of the Brown Act and enabled virtual participation for legislative officials and members of the public to participate in public meetings. So we will go back to the old set of rules after September 30th, and that's kind of a target date that we're looking at for resuming in-person meetings, at least of the City Council, obviously depending on public health conditions. I mean, if for some reason, we need to continue to meet remotely for public health reasons, then we will continue to do so. But the plan is post September 30th to look at sort of targeting that as a time for the transition back to in-person meetings.
That's correct. And that would be not only for council, of course, and that'll be a decision that you all will be making if there's a hybrid scenario for you, but for our commissions and our boards, those will either need to be in person completely or via Zoom or a remote completely. And so we envision that they will all be meeting in person at this time. But again, we are hopeful that there won't be a change in a requirement to distance in the workplace. And so the distancing was the piece that kind of decided whether or not we could house and host our commissions and boards in-house. And with the distancing requirement relaxed, we see no reason why they can't meet in person. But we won't be able to have a hybrid for our commissions and boards. But thank you.
Yeah, obviously we need to follow state law, but we also want to do this in a way that's thoughtful, and that's continuing to center public health in the way in our sort of implementation of these rules. So wanted to provide that update as well, because that's something that we have received some questions about. So with that, I want to turn to the questions that we received from Berkeley residents. And the first set of questions, which are really sort of operational, I'd like to direct to the city manager. First question is around the American Rescue Plan and how much money did we receive, and what is our plan for using those funds?
So, Mr. Mayor, as you are aware, we received 66 million and some change from the federal government to assist our cities locally here with rejuvenating our economy, addressing COVID, and also impacts to our businesses and community members. So those funds have been broken down, and again, these are all recommendations, but the city will need approximately $47 million of the American Rescue Plan to cover all funds across the city. Particularly, I believe it's 21 million for our general fund. Of that, $2 million will be going towards our arts community. Another 8 million will be projected to, is being recommended for our SCU, which is a new way of delivering services for mental health support to our community. And that will also be augmented by the city police department budget to cover a number of expenditures as it relates to reimagining, and also as it relates to some of the new change in delivery from our police department. There are a number of other small amounts that will also be deducted, but again, this will be completely outlined in the mayor's proposed budget. But those are some highlights of how the American Rescue Plan dollars are projected to be spent. As many of you on this call may know, the American Rescue Plan dollars were explicitly set up with very strict guidelines on how the city can use the funds, and economic rejuvenation is one. Looking at infrastructure is another, as well as COVID-related items and loss in revenue. So for the city of Berkeley, we did experience a huge, I would call a tremendous loss in revenue to our city coffers. And so we are using those funds to actually recoup the revenue loss so that we are able to continue city services for our community. So, Mr. Mayor, you may want to add more to that discussion, but that's the specifics at a high level for the American Rescue Plan dollars.
Thank you. So, yeah, we're receiving, roughly 66 million over a 2-year period. We're, I think, proposing expenditures of over 40 million for fiscal 22, and some of that is revenue replenishing revenues that we did not receive due to the economic impacts of COVID-19, and then the specific expenditures supporting the arts and public safety and enhanced mental health response. That does leave about, anywhere between 18 to 15 million in additional revenues that are unallocated, and we don't have a plan yet for how to expend those resources. And it's worth noting that, a budget is really a projection of anticipated revenues and expenditures, and we may see greater sales tax receipts or improved economic health, which means that we won't need to draw on some of those ARPA dollars as much as we may have originally anticipated. So obviously more to come, but certainly if it wasn't for this this really critical funding, we would be seeing a pretty significant budget deficit this next year. Thank you so very much. Okay, moving to the next question about 4th of July. What is the plan for 4th of July celebrations, and what steps are being taken around wildfire danger due to people shooting off illegal fireworks? Oh, you're muted.
Thank you, Mr. Mayor. So in terms of fire mitigation for the 4th of July, first, the 4th of July event will not occur at the City Marina this year. Hopefully next year we'll be back in business and we'll be looking at a 4th of July celebration like no other. I would hope we can get there. In terms of wildfires and preventing and looking at prevention tips for our community, and we will be putting out a message to our Berkeley community, expressing ways in which to stay safe, encouraging folks to not set off illegal fireworks or any fireworks in our community so that we can prevent any wildfires. One of the things that I think is important is that our police department and fire department will be staffing up during the work up to the 4th of July actual date and thereafter. So one of the things that we're doing with fire is we are deploying engines in the Berkeley Hills as a way to mitigate potential fire weather issues, but also to mitigate some of the fireworks from going off in the hills and kind of be out there in a preventative way so that our community can see us and see that we are taking very seriously those that choose to set off illegal fireworks in the city. It is against the law, so we would expect that folks will follow the rules and secure a safe site that is, somewhere in the communities surrounding our city that are having 4th of July events and celebrations. So we encourage folks to go to those locations and enjoy their 4th of July and to tune into our website for more information. It will be published soon. So thank you.
Thank you so much. There was a question around when full library services will resume. I know that we have partially opened the libraries. You did mention July 19th as a date for full reopening of city facilities.
Yes, so we are envisioning, so at this point, we are tentatively planning to reopen. There should be no reason why we are not reopened on July 19th, but should there be, we will communicate that. The library has been following in step with the city of Berkeley, with all of our facilities, as well as the rent board and other facilities that have their own boards and are led by a different set of elected officials. But we have all worked very closely together as we walk through this pandemic. And so I would envision that the library will have full reopening at the same time that the city of Berkeley facilities are reopened during normal 8 to 5 business hours.
Thank you so much. There was a question around the implementation of the Berkeley single-use foodware and litter reduction ordinance and whether the city will begin implementation and enforcement of that policy now that some of the shelter-in-place restrictions have been lifted.
I don't have a full update on that this evening, Mr. Mayor, but what we have been doing is trying to work with not only our businesses, but also with our elected officials to determine when and what parts of that ordinance will be reset. And I would envision that we will be moving back to that fully in terms of making progress around the full implementation of the ordinance. But at this time, I don't have a date or where we are in terms of that implementation. So more to come on that.
Thank you. There were a couple questions around homelessness. I think since these are really enforcement questions, it might be appropriate to address them at this time. A couple of questions around, when are shelters going to go back to full capacity? And as a result, when will the city transition people out of encampments on public sidewalks into shelter or do other enforcement of various ordinances and regulations?
So, Mr. Mayor, a number of things have been happening since around June 15th. And I'll start first by sharing our plan to address the encampments across the city. So number one, our staff have been doing a lot of outreach to all of our encampments across the city, informing individuals that the city will be reinstating our approach to the sidewalk ordinance, which restricts the amount of property that individuals can have on a sidewalk, and that tents on a sidewalk during the day are prohibited. And so we will begin enforcing those rules over the next couple of weeks. We will start with a high level of education, but then we will be taking very strict action to reduce the amount of debris and garbage that are on our sidewalks. That doesn't mean that people can't be on a sidewalk. What it means is that they have to limit the amount of property that they have on a sidewalk. Also, our park rules will be enforced beginning July 1. And people have been informed that individuals are not allowed to lift up tents in our parks, and that is a current and existing park rule, and we will begin enforcing that rule. As you know, we have limited staff available to do this work. However, we've been putting the word out that we are going to reinstate park rules, sidewalk rules, and all in coordination with the opening of a new shelter for the city of Berkeley. I want to thank the mayor and the council, of course, for their support and their just complete support of making sure that our Berkeley homeless community has options. And that's something that I don't think everyone understands. We provide options for people in our community, not only shelters, but housing, hotel vouchers, as well as our Pathways location, which is a congregate setting opportunity to the next step, which goes into permanent housing. And we support folks keeping them from being on our streets and losing their place of residence. So we provide a lot of resources and a lot of options. So on July 1, we'll be opening a new Horizon shelter located on Grayson Street in Berkeley. That shelter will house up to 40 to 50 individuals, as well as looking at the parking lot adjacent to that facility to open up an RV parking lot. And we're envisioning that to come online very soon. So we're really excited about the shelter, the Horizon shelter at Grayson Street, and we'll have a grand opening celebration for that coming up soon. In terms of our existing shelters, our Pathways project and other locations, the Veterans Building and other locations where we currently house individuals, we are working with our health department and the community-based organizations that actually staff those programs to determine when and what's needed to open up those facilities. Well, they're open, but to increase the number of bed space at those facilities. So we're working on that currently. And so we anticipate a number of available bed spaces to be freed up, and we'll have more opportunity to move people into shelter opportunities. And then lastly, I want to mention that, and I don't have all the details at this point, but we are looking at a hotel in Berkeley, not only a permanent hotel for us to house individuals, but also a temporary process on July 1, where Alameda County will be working with our city to lift up hotel rooms for some of our most vulnerable community members. So things are looking up in terms of where we'll have available space so that we can go out and encourage people to move into these facilities and less people on our Berkeley streets. However, as we know, not everyone wants to go into a shelter, and we've tried really hard to make it an easy transition for folks, addressing things such as whether or not pets can go with them, or how much property can they take to the location with them. So we're looking at all of those avenues and trying to make it easy for folks to want to transition to some of our congregate shelter facilities. Thank you.
Thank you so much. There was a question around the Grayson shelter, which there have been some recent news articles about, and as you would announce, it's going to open this Thursday, July 1. And the question was really, why in West Berkeley? Why not in the hills? Well, I'll say, I don't think there was a large enough space in the hills to accommodate this shelter. Moreover, it's not zoned for emergency shelter. And we spent quite a bit of time looking for locations and looked at a number of options. And this really was the best location for the price, and is a huge property that provides a great deal of space and flexibility for us to have not just shelter, but social services delivered on site, safe parking for RVs. And so this was a really incredible opportunity that we could not pass up, and is going to provide the city the ability to serve a greater number of people who are experiencing homelessness in a variety of different ways, not just the standard shelter model, but safe parking, employment services, social services, delivered on site. And it's a really exciting model, and we're really excited that it's going to be launching. Okay, so I want to turn these next questions over to Dr. Hernandez. And the first question is around the Delta variant, not surprisingly, given the many articles we've read about and concern, I think, in the community around the growth of this variant. Could you please share your concerns about the Delta variant and the Delta Plus variant? Has it come to California? Has it come to Alameda County? This resident wants to say thank you for all that you did and will do to get us through this challenging and tragic time. Yes, I have been vaccinated against COVID-19.
That's great to hear. We need more and more people vaccinated. As I reported earlier, we're doing a great job here in the city and the county, but there's still, a third of individuals that need to get vaccinated. And the closer we get to 100%, the more protected we'll be. So the question about, am I concerned about the Delta variant? Absolutely concerned about it. What you've heard in the news about it being more transmissible is definitely true. That's we expect mutations of viruses to occur, and when they mutate, one of the things they want to do is be able to survive, or to be able to be transmitted better, more efficiently. So that's what this virus has done, is mutated, and it has, with this variant and some of the sub-variants of the Delta, have become more transmissible. What we don't know is it causing more severe disease? We have seen cases in the United States, and we have seen cases here in California, but we haven't really been able to determine whether we're seeing more severe disease due to this variant or not. So we're getting information on that now, and hopefully we'll know. We know that it has caused some severe disease in other countries, but their vaccination status is different. They use different vaccines, and their healthcare systems are different, and the health of the communities are different. So we cannot compare what we're seeing globally here in the United States, but definitely something we're watching. In terms of monitoring the variants here in California, about 10–11% of all positive tests are being sequenced. So we're not doing the majority of the sequencing yet. We're getting to a point where we're going to have a better capacity, but so we're not sequencing a majority of the cases that are being diagnosed. So it's just a snapshot. So what you hear, and I'll report a little bit about what we're seeing with the variants in a second, but what you'll hear is just a snapshot and doesn't represent the total number of infections due to these variant strains that might be circulating in our state. So in California, what we're seeing as of last week, about 14% of the viruses that were sequenced were the Delta variant. It is not the predominant variant yet. Again, this is only of that 10% pool, but it's about 14% of that pool. What's still predominant is the UK variant, which is now called the Alpha variant, and also the P1 variant, which is the Brazilian variant. So we're seeing those variants circulating more. than the Delta variant, but I do expect us to see more of this Delta variant in the state. As I mentioned in my opening, we do have one case again, but that's just a drop. I do believe that we probably have more cases circulating just because we know that we're only able to sequence a small amount of the viruses and the cases that are around. So what can we do? Again, we want to vaccinate as many people as possible because we know at this point that the vaccine seems to be protective against this variant. And we also want to, in certain settings, especially when you don't know if people are vaccinated or not, it's okay to wear a mask. And I still think we need to weigh our risk and benefits because even though all the most of the restrictions have been removed, there are still individuals who can't get vaccinated. For example, children under 12. So there was a question in our last town hall about what can I do as a parent of a child that's not vaccinated. I would say that if you're one of those individuals or you are in a family or a household with individuals who can't get vaccinated, you do want to be a bit more careful in terms of where you go or wear a mask. I wear my mask more often. I'm out more, which is nice, but I still wear my mask, and especially in certain businesses and in other settings where there isn't social distancing. So I'd say we're not out of the woods yet. These variants are things that are definitely making things a little tricky at this point. And we will continue to monitor the variants. We're closely monitoring them in the city and throughout the region and the state.
Thank you so much. There was a question around sort of, I guess, personal care services and what specifically the protocols are around hair styling, haircuts, facials, massage, since wearing a mask may be a deterrent or may add more complexity in receiving these types of personal care services.
There are no restrictions for general restrictions for that service anymore in terms of masking, though the masking rules are if you're unvaccinated, you have to wear a mask inside. So if you happen to be unvaccinated and you want to get these services, you will be required to wear a mask, and they may ask you, or it might be you might attest yourself, but that's the requirement. Some businesses might be more restrictive, as I mentioned. This weekend I was in certain businesses and they were still requiring masks, and salons might be one of those, and spas might be one of those businesses that will require it.
Thank you so much. There was a question around indoor sporting events. This resident says, I've been a referee for Berkeley adult volleyball for many years. Is there any reason due to COVID concerns or budget impacts that adult indoor sports cannot reopen now?
There are none. And thank you for being a referee. I appreciate that. My kids, they don't play volleyball, but they are in youth sports, and I know you're adult sports, but thank you very much for your dedication and service. But there are no restrictions for the sports. The only restrictions right now are in terms of verification of vaccine status or testing in mega events. And then again, and that's for indoors greater than 5,000 people, which I doubt the setting where you would referee would fall under. And then again, indoors, people who are not vaccinated need to wear masks. Those are the big state guidelines. Businesses might have stricter regulations. but that those are the ones that are being imposed by the state. And again, City of Berkeley is aligning with the state's guidelines.
Great. Thank you so very much, Dr. Hernandez. I'm going to address the last question, which is first, I guess, starts out with a statement, then a question. Thank you so much for your leadership, Mayor. Someone who just moved to the Bay, I really felt inspired by your leadership. Thank you for leading with such vision and resilience during these times. One question for you is, what do you think will be the biggest change in public policy in Berkeley post-COVID-19? And it's a really good question. And I really think I think the more significant changes, I think, are really two areas. One, how we use our public spaces, and two, how we provide greater economic security for people in our community, in our country. So, as we know, and this was really due to the physical distancing restrictions that were in place throughout most of the pandemic. Berkeley and many cities throughout the state allowed expanded outdoor commerce, including a quicker permitting process for people to have sidewalk seating or to create parklets to provide additional space for outdoor commerce. And this really has transformed a lot of our commercial districts and has really brought just new life to our city. And we've also implemented a slow streets program where we have converted several miles of streets throughout Berkeley to limit traffic to only local access and to pedestrians and bicyclists. And it's really great to go throughout the city on weekends particularly and see families riding their bikes on these streets, which are not congested with cars, to see people walking, jogging or walking. And I just really think the reclaiming of our streets and public spaces is one hopefully lasting benefit, that positive benefit that we can sort of take out of this pandemic and move forward. And we just voted, actually our last city council meeting, to adopt legislation to allow parklets that were created during the pandemic to be able to be permanent in the city of Berkeley, and to expand use of our streets and sidewalks for public use and for public space. So that's one thing. And then I'll just say, the emphasis on providing greater economic security for our residents, which is just something we had to do. I want to recognize all the essential workers, the nurses, doctors, bus drivers, public safety personnel, grocery workers, and we need to respect them and lift them up as we're coming out of this pandemic through better wages and access to housing. Ideas like universal basic income have become more prominent in public discussion in the United States as a way to provide a bridge for people who have seen a loss of jobs or significant reduction in income. The federal government, the state government, and even city government had to move very quickly to provide emergency grants to residents and businesses to make sure that we can keep our businesses open and people can pay their rent and have money to be able to take care of essential needs. And so I think all the different laws that we passed, such as the eviction moratorium, the different types of emergency assistance that we've created, I think have created a safety net that has really helped keep our community and our state and our country, has helped get us through this past year. And I think it's a foundation that we should build on to address a lot of the structural inequities that exist in our society, and that have resulted in just a growing wealth gap and even greater homelessness and housing insecurity, that these are things that we can build on for the future. Whether it's, greater protections for renters and businesses, rent relief, emergency rental assistance, and things like universal basic income. So, I think that's another outcome, is really the safety net that was created, which was essential and we had to do it, and how we can build on that to provide greater economic security for people in our community. I think that's an area that really has got to be a focus of our broader strategy of economic recovery post-pandemic. So those were all the questions that we received tonight. And so with that, I just want to close by thanking our our incredible city leaders here, our health officer and city manager, for your tireless work and leadership over this past year. You really helped get our community through a very difficult time. Your actions saved thousands of lives. And while we know that this was a real collective effort, a partnership between the city and the community, there's no question that your immediate prompt, thoughtful action made a real impact. And I think we can look back in the future and be proud of what we've done. And so I just want to, in closing, thank the Berkeley community for tuning in these roughly 30 town hall meetings, for the over 1,000 questions that we've received, for your interest, your ideas, your commitment to science and to helping protect our community's health. And, we're going to be even stronger as a result of the challenges that we've endured this past year. And it's really an honor, greatest honor of my life, to serve as mayor of this incredible city. And I'm just filled with such immense pride to be part of this city organization that has really stepped up in so many ways to serve our community this past year, and to represent such an amazing community of thoughtful, civic-minded people who have really put their health and the health of their broader community front and center, and have really been focused on looking out for everyone and lifting up everyone in our community this past year. So with that, I want to turn the floor over to our public health officer to invite her to make some closing comments.
Well, thank you, Mr. Mayor. I want to echo your comments as well. It has been an honor to serve the community and serve under your leadership and the leadership of the city manager as well. This has been a tough time. It may continue to be a tough time. I hope not as tough as it was a year ago. But I know that I have the support not only of the individuals here on this panel, but the community as well. And I want to thank the community for their support. We have done this together, not only the community here that listens to the town halls, but everyone here in the community of Berkeley. And I appreciate that. And I am forever grateful and honored to serve this community. And I will say that I will continue to serve the community, and we will continue to monitor the transmission of COVID throughout not only the city of Berkeley, the region, and the state. And we will continue to protect the community as best as we can. And it has been an honor for me to serve the community, and I will continue to do so as long as I can. And I will hand it back to you, Mr. Mayor, and again, with thanks and gratitude to everyone.
Thank you so much, Dr. Hernandez. I want to, in closing, turn it over to the city manager to give her the opportunity to make some closing comments.
Thank you, Mr. Mayor, and Dr. Hernandez. Thank you so much. Always a joy working with you and making sure that our Berkeley community receives the absolute best care and service. So thank you. It looked easy on the outside, probably to folks, but we know that in the inside, we were working late hours, early mornings, all weekends. And along with our mayor and council, folks were really engaged in making sure that people were safe. And then we watched our community do their part. And so it's been a phenomenal time for all of us, and our resilience has truly shown. I want to just thank our Berkeley employees, the City of Berkeley workforce. They've been out there from day one, whether it's picking up waste and garbage, or it's working in our parks, or responding to calls for service, both police and fire. And these are, in our mental health and public health folks have been out there all along. And I just can't say enough about them. We are truly one city, one team. And that really resounded through the last year. And Mayor, thank you for having trust in us and supporting us through all of this. We've done this well because of your support, and I can't thank you enough. So thank you, Berkeley community. It's been my honor to serve.
Well, thank you so much, Madam City Manager, our City of Berkeley Public Health Officer, Dr. Hernandez, once again, for your incredible leadership. We will continue to keep the community updated about developments with COVID-19. We still encourage people to go to the city's website, cityofberkeley.info/COVID-19. My office will continue to send out regular updates with relevant information. We are going to continue to monitor this, and obviously, if circumstances change and additional measures are needed, there's no question that we will act accordingly to protect our community's health. But given that we are at this point, this inflection point where after having reopened our economy just a few weeks ago, having a very, very positive rate of vaccinations of our residents, we felt that now would be the time to suspend these monthly town hall meetings, but the commitment to keep the community informed will remain. So with that, I just want to thank the Berkeley community for tuning in and for participating. And once again, thank you for all your incredible sacrifice and commitment to getting our city through this last year. And I think we'll be even stronger together going forward. So with that, please be safe, everyone. If you have not already been vaccinated, please get vaccinated and have